So this project about preventing readmissions following an elective insertion of a gastrostomy tube was started based on the number of readmissions we were getting. The group of patients we identified was those who had a gastrostomy placed as an outpatient in an elective procedure. So if the child was an inpatient, we did not include them in our data. Originally, we had a 13% readmission rate. And this data was gathered as like a retrospective chart review. So we met as a multidisciplinary team and brainstormed ideas of what could be changed to prevent this readmission. As you know, any readmission is a setback for the family, for the patient. We want them to stay at home. We want them to have a successful recovery and be part of their family. First of all, we focused on educating the nursing staff about what our project meant, what our goals were, and how we were going to get there, the plan. We placed emphasis on educating the parent or the caregiver with information using videos, using handouts, and actual hands-on demonstrations. So what I did was get a kit together with a brand new G-tube itself, the actual button, the extension tubing, the syringes, the burping equipment, everything a parent might need, and actually had them touch it, hold it, play with it. So they got comfortable with actually the equipment before they even had to touch their child. In addition to that, part of my role was making a follow-up phone call a few days after the child was discharged home. I came up with a list of scripted questions. We wanted to identify potential problems which could lead to a readmission so that we could nip them in the bud, such as pain, what the surgical site looked like, tolerance of the feedings, making sure they had adequate supplies, and also, just their comfort level in general. Any questions I was able to answer, I did. But if there were questions that needed immediate attention from the provider, I would either call them or email them with this information so they could get in touch with this family. The results we found, initially we got down to a 4% readmission rate within 12 months. And I got new information just recently, and we're actually down to 1%. So I'm really excited. So as you can tell, this project is ongoing. It is a success. Please feel free to contact me if you have any further questions.